We have all the services that I potentially will need, starting with audiology or hearing testing. The hearing testing can be done on any child of any age. We have a speech pathologist in the practice that can help me in evaluating and treating any type of voice issues, which many of the practices in town don't have. The problems, the most frequent routine problems are ear infections, sinus infections, large tonsils, frequent strep throats. So this is quite routine, and that's probably the typical patient that I would be seeing here. Probably some of the most complex things that I am trained to deal with is voice box issues, both congenital, meaning that children might have been born with, and something that happened after birth as a result of an infection or as a result of trauma. And these are issues that most other ENT people are very hesitant to treat, and these are the most complex patients that I do have. Typically, if there is anything in common, is the apprehension of anesthesia. For good reason, parents are always they don't have much of a fear when it comes to the surgery itself. They always are confident and very trusting into me to allow me to do whatever surgical procedure the child requires, but the apprehension always evolves around the anesthetic itself. To reassure them and my audience, I will tell that the people I work with are excellent and well trained in pediatric anesthesia. And I need to knock on wood, in 30 years I've not had a child that has ever been injured or sustained an irreversible injury as a result of anesthesia. I hope it never happens. Once I have examined a child and have assessed the issue at hand, I usually am very thorough in explaining to parents how I'll be treating it. I will explain to them all the approaches available to a particular problem, whether medical or surgical. I will tell them the risks and the benefits involved in treating the problem, as well as the risks of not treating the problem. I'm always happy to answer anybody questions. I'm always there until all questions are answered. Usually very patient. I usually don't rush. I don't have a train to chase or an airplane to leave town.